Fantastic. I've just unmuted myself, and I want to say we have an amazing group of speakers today to celebrate Women's History Month, and and what we've been doing. For those of you who are here with us for the first time, we have an essentially every other week Tuesday town hall. We've been doing this since the start of the COVID pandemic. We started with every Tuesday. We sometimes do this as a teletown hall. We sometimes do it as Facebook Live. We've done it sometimes on Thursdays. We had NEA and we had hosted Dr. Fauci. That was a second fireside chat with Dr. Fauci. We had Dr. Biden and Senator Warren on a FaceTime Live fireside chat. We had a few months ago, we've had Dr. Redliner. This month, we had an incredible teletown hall honoring Black History Month with several of our members talking about what they do and how they find joy. And this month, rather than simply talking about these amazing sheroes, which they are, we decided that we really needed to talk about vaccines and how we make vaccine more equitable, make sure that there's more access, and really also dig deep in terms of how the COVID pandemic has affected families and, frankly, disproportionately affected women. Now, initially, what I'd like to do, let's just let me just have the speakers again, because I just want to introduce them, and then I'll speak for a couple of minutes, and then I'm going to turn it over to our first speaker after I speak for a few minutes, Dr. Marcela Nunez-Smith, who is the chair of the U.S. COVID-19 Health Equity Task Force and senior advisor to the White House COVID-19 response team. And Dr. Nunez-Smith, I could not say that 5 times fast, but she's a really big deal. But we also have a lot of other really big deals. Many of you from our ranks know Julia Barcott, who is an ICU nurse. She's on the AFT's Women's Committee, and she's also one of our RNs and one of our PPC members, meaning she's a big deal leader within the AFT. And we're so glad that we could do this in terms of so many people who are so deeply rooted in medicine and healthcare. And then we have Cindy Benavides, who is the CEO of LULAC, which we have worked with LULAC in so many ways, including doing a parent survey earlier on in the year when we did parents and teachers trying to figure out where everybody's head was in terms of how we reopen schools. And then we have Dr. Patrice, there's a lot of doctors here. We got Dr. Patrice Harris, who is the immediate past president of the American Medical Association and its first African-American president. Thank you, Dr. Harris. And then we have Dr. Elena Rios, who is the president of the National Hispanic Medical Association. So I am completely underqualified here because I am a high school social studies teacher and a lawyer. I could never do what any of you do in terms of the work, in terms of healthcare. And let me actually just start there, because healthcare workers, 3/4 of healthcare workers are women. What healthcare workers have done for all of us in this pandemic is incredible. But what has happened, we've had lots and lots of lifting up of healthcare workers. But what we're not seeing is the burnout from the physical and the emotional exhaustion, which is really real. Many are experiencing post-traumatic stress, not stress, maybe stress too, but it's really stress. And I think that as we pass, every death is something that not only affects families, but affects the healthcare workers who have tried to keep someone alive. As someone who has healthcare workers in my family, of which I have many, listening to them over the course of this several months, as well as my members, We have to do something to help healthcare workers deal with the stress and the strain, and we as a union are trying to do that. Second, though, women have also borne the brunt of the pandemic job losses. Women ended 2020 with 5.4 million fewer jobs than they had in February before the pandemic began. And just in 1 month, in December, the US economy lost 140,000 jobs. All of the losses were held by women. And for women of color, the impact is even greater. At one point, 1 in 9 Black and Latino women were unemployed, a rate 57% higher than white women. And I'm really reading these statistics because I think people have to see that the inequities, not only we know the inequities in terms of kids who get their meals at schools. We know the inequities in terms of kids that didn't have devices at home. We know the inequities in terms of what happens in our urban schools that have terrible ventilation systems and have not been retrofitted. But we see this in every piece of this pandemic. And ultimately, we saw it as well in terms of the disproportionate impact of COVID on Black and brown communities. So we're seeing this in so many different ways. So what's the anecdote, or what's the antidote? Joe Biden's presidency. Because what we've seen, it's not just the incredible work that all of you do, but what Joe Biden has done and what Kamala Harris has done, and in bringing together and bringing people like Dr. Marcela Nunez-Smith into the administration, is that this is about trying to disrupt poverty, trying to disrupt inequity, trying to actually, so what was the American Rescue Plan? It is about what we have to do in the first instance for vaccines access, for testing access, but it's also about how we make sure states and localities have the money so that we can continue services. Since 40% of essential workers happen to be Black and brown people. 40%. And so how are we going to make sure that people are not laid off or fear layoff at the same time as all of this is happening? The second thing we have to do is we have to make sure that we deal with poverty. That's what the child tax credit is about. That's what the checks, the $1,400 checks are about. So it's about the long-term, the short-term recovery for unemployment, for rent, to stop eviction of renters, to make sure that there's COBRA, to make sure that pensions are okay. It's also about making sure that we deal with struggling Americans, making sure that people have SNAP, making sure that there is food on the table, making sure that we have the checks in people's hands, making sure we have the child care tax credit or childhood tax credit. And it's also about making sure that we have the money for our schools to recover, our hospitals to recover, as well as our localities and states to have the money that they need. All of that is great on a macro level. But what this group of people are going to talk to us about is on a micro level, meaning how do you make sure that we get shots in the arms? How do we make sure that when community healthcare centers are supposed to have vaccines, that those vaccines go for people in the neighborhood? They don't go for people in another neighborhood who happen to be white, who have the resources to get on a computer to get those shots before people in the neighborhood get those shots. How do we make sure we deal with hesitancy? How do we make sure access is there? How do we talk to people? How do we get so many shots in the arms and then shots in terms of families too? And what else do we need to do to make sure we recover and we deal with the path to resilience and relationship building and greater equity? And so with that, I want to first introduce Dr. Nunez-Smith, who I introduced before, who, as I said, has lots and lots of big work to do right now. But Dr. Nunez-Smith directed the Yale's Equity Research and Innovation Center, which she founded as well as research collaboratively funded by the National Institutes of Health to study chronic disease in Puerto Rico, Trinidad and Tobago, Barbados, and the U.S. Virgin Islands. And ultimately, thank you, Dr. Nunez-Smith, for doing this work and tell us, you can tell us a lot, but tell us the kind of equity issues that you're working on right now, and tell us how we as a healthcare and an education union can help address the equity issues. Thank you.
Yeah, well, good evening, everyone. And Randy, thank you so much. Thanks for this event, for inviting me, and just thank you for your leadership, and really to all of the members the same. It's just a privilege and an honor to be on this panel and look around. These are fierce women. I love it, the sheroes, and humbled to be in this company. I'm so eager for this conversation, as we talk about how we make sure people have access, and that people who are ready, eligible, and at yes, how do we make sure that they are connected with vaccine? If I might, I'll just take a couple minutes maybe to step back and to continue. You framed us beautifully, but I think the context is so important in this conversation because we know that the inequities didn't arrive yesterday. It really is quite hard to believe. You spoke to some of these statistics. It's a month ago now that we passed a very grim milestone. We've lost 500,000 lives because of COVID-19. And that is a moment that we have to stop and honor, because those are our friends, our neighbors, our family members. But I'm holding a lot of optimism because we also just recently surpassed the 100 million vaccination administered in this administration, well ahead, a day 58, well ahead of the 100-day goal that was set. So it is very hopeful, and we are looking ahead to increasing vaccine supply. And so we know that it's often the marginalized, the minoritized communities that are the first to be forgotten when resources are scarce. And we're going to disrupt that narrative, as you said, and we're going to make sure that people get connected with vaccine. It wasn't long after COVID-19 was identified in the US that we saw those disparities: testing, cases, hospitalizations, death. We're seeing now emerging disparities in the burden of long COVID and access to therapeutics. And of course, we're seeing those early patterns in differences and inequities in vaccine uptake. You mentioned it as well. We need to acknowledge that mental and behavioral wellness is still elusive for far too many. So we have to think too about the intersections of all of these marginalized and minoritized identities, whether we're talking about race, ethnicity, rurality, disability, age, sexual orientation, gender identity, and many of these factors overlap. And the reality is COVID-19 has just taken advantage. It's laid bare what we know are social structural drivers and problems that impact health. And so the conversation we're going to have tonight, I think, starts with the principle and acknowledges equity never happens by default, only with intentionality. We have to move through COVID-19 response, and you said it, the recovery. We have to build resilience. We have to, and we have to be so intentional that there are pathways to opportunity for everyone on the other side. So, I just have a personal note of gratitude, because whether you're working hard to ensure the children in your classroom are adjusting to learning from home. I'm a parent too. You're juggling your own children, holding a patient's hand because their family couldn't, making decisions for your community as a member of your local government. Everyone is experiencing the physical, the emotional toll of this pandemic. We have to acknowledge that. And I want to say thank you. Thank you for everything that you've done to get us through this past year. We're not all the way through it yet, but I hope you too are starting to see the light at the end of the tunnel. So thank you again for your leadership, your service, and I looking forward so much to being in conversation with all of you tonight. Thanks again, Randy.
Thank you, Dr. Nunez-Smith. And, we appreciate, for those who are watching, I spent a lot of time talking to people in the transition from November through January 19th. And Dr. Nunez-Smith was on countless numbers of calls that I was on, and just constantly trying to figure out, how do you take policy and make it into practice? And you are so great at that. And I just wanted to just lift up my appreciation to you about all of that. Thank you. So I want to just introduce our next speaker, which is Julia Barcott. And for as I said, for those in our union who are watching, and particularly in our healthcare units, you've seen Julia a lot. She's an ICU nurse. I think there was one time she was on a Zoom when she was in her break room, and but she really wanted to be on that Zoom. And I just can't thank you enough. Julia is not only an ICU nurse, she's not only on the women's committee, she's not only on our RNPPC, but she is also a nurse at the Yakima Indian Reservation and has served as a frontline healthcare worker this entire year. And I just really want to ask you a little bit about, that how you see that experience now. I've asked you that question before when we were in the midst of it, because Julia's from Washington State. But also, how do you bring in more RNs, LPNs, and CNAs in terms of rural healthcare, in terms of how do we induce people to actually go to places that are really, really underserved, like you have done, Julia?
Well, I think that's a great question. Luckily, where I am practicing is Toppenish on the Yakima Nation. So we serve Indigenous, Latinx, and a number of different cultures there, which is a passion for a lot of people working down there. We actually do have a nursing program at Heritage University down there, and we have a couple of the Washington State University in Pullman that has nursing programs as well in our area. And I think we really have to grow our own. I've been very impressed with a lot of the young nurses that have come on, many of them right before COVID hit. So they've been inundated in our ICU and our medical surgical units. And they are intelligent people who are serving their own community and have a lot of passion for it. I think that's something that I'm very impressed with down at this particular hospital. And I think we have to do a lot more of that. I also feel like one thing, we expect people to know what nurses really do. And one thing that this pandemic has shown is now the public does know we're not like the TV shows. We actually are center and we're the leaders for our patients' healthcare. We're the advocates for them. And that a lot of issues we brought up are validated by this pandemic. We've been concerned about healthcare inequities for a long time, and we have seen it in practice for a long time. We've also been very concerned about the cuts to public health. Since public health is supposed to be the first one on the front lines for any pandemic, obviously that isn't working well because we've done so many cuts and there are very few nurses now in public health. And there is a lack of preparedness. We always go through emergency preparedness, and we always hear about the flu pandemic that's going to hit. Well, none of us were prepared. And myself, if I wanted to get a group of people in my community that are healthcare workers together to go out and do a vaccine clinic, I have no access at all to how many people are in my community, in my county, that are nurses. There are some state websites you can go to and sign up if you want to be involved in being called and going out and helping. But I think we have to go a lot further than that and be prepared beforehand so we can utilize all of our healthcare workers. And we already know what we're going to do. And it's not a cluster like it's been in the past year. So those are some of the things I think that would really help us get more people involved. But I think now at least the public does know what we do. And since we are the most trusted profession, I think we need to step up and take a front role in getting vaccines out to people. Even if we have to get a minivan and go out there and do it ourselves in the field, that's what it's going to take. And I'd like to see a lot more of that because I think we can get a lot more people in communities involved.
Thank you so much, Julia. And this was a question I was going to actually start with Dr. Harris with, but I'm going to go to Cindy first. Cindy Benavides. Cindy, the LULAC, by the way, is the League of United Latin American Citizens, LULAC, and it is the oldest and the largest civil rights organization in the country. And what Cindy has been doing since COVID started is supporting community and essential workers trying to get the kind of emergency funds that we need. She's been, as has LULAC been, all across the country addressing healthcare disparities. And now LULAC is really leading a national campaign to get more Latinos and Latinas and vaccinated. We're going to say, we'll get to the question of our younger, not our younger siblings, but young people, and whether our grandmothers and grandfathers can actually convince our young people to get vaccinated, and how we do these kind of things. But let me ask you, in terms of two questions, because you've been in the field kind of looking at the impact of COVID on essential workers and on work. And so how do we rebuild the workforce? And, you and I have talked a lot about why we need to reopen schools and how important that is to, getting to a normalized schedule so that moms can really rely on that. But what do moms need, and what do Latina moms need in terms of the workforce and in terms of support? And how can you help us with that? Help us, educate us with that.
Randy, muchísimas gracias. And before fully jumping in, I just want to give AFT a shout out, a praise. I'm actually down in the field in Gainesville, Georgia, with Evelyn de Jesus, who's our Executive Vice President for AFT, with Frederick Ingram, who serves as the Secretary Treasury, with Danita Merino, who leads LACLA, with Cesar Moreno Perez, who's always getting me into good trouble. And, talk about words being inadequate and how much action matters. And when our workers need AFT shows up with the entire team, right? To make sure that our workers understand that we stand in solidarity with them, that each of us is all of us, and that we will absolutely be protecting, defending, fighting, calling out, making sure that they have that attention. And as I think of your question, Randy,
Cindy, why don't you tell people what we're all in Georgia for right now? Tell people why we're there.
Sure. Thank you for that, Randy. In January, on January 28th, there was a nitrogen explosion that happened at a local poultry plant. And to this day, there has been no accountability for the 6 deaths that occurred. I know that AFT, along with LACLA, with LULAC, and so many others, are calling attention to this issue because we want to make sure that our workers don't feel like they're putting their lives on the line simply for showing up to work and being the essential workers of America. And, to give you a sense, specifically around Latinos, as a Latino civil rights organizations, we know that 5 out of 6 Latinos each day have to leave their houses to work and get paid. And what we saw here in Gainesville, Georgia, was that of the 6 deaths that occurred, 5 out of 6 of them were Latino. And yet we have not, 2 months later, seen accountability on behalf of the governor, on behalf of the company. We're still waiting to hear more what happens. There's no PPE that's being provided to our workers. And in fact, individuals are being fired for coming down with COVID-19. And so we want to make sure that our workers understand we are watching, we are calling them out, and we will stand with them, whether it's in Gainesville, Georgia, or in another part of the country, including Puerto Rico, to make sure that our workers have those protections. And so, Randy, before I even jump in, I just want to say gracias, because it's not enough for words, right? We've already seen plenty of statements. We've already seen, plenty of speeches. At this point, what we want from everyone is to see action. And this is where I think we are seeing the Biden administration, with the leadership of Dr. Marcela Núñez-Smith, with now Secretary Javier Becerra, and so many other leaders, begin to finally get action, get things done so that our community can have access to vaccines. And so as I think of the labor force, Randy, and as a Latina, as a mother, this is an issue that's very close to my heart. You know, to give you some statistics, in January, there were 346,000 worker jobs that vanished from the US labor force. 80% of those jobs were held by women. When we look at unemployment rates, 5.1% of unemployment is Caucasian women, 8.5% is African American women, 8.8% are Latina women. What we're seeing during this pandemic is a complete rollback of all the work that has happened to make sure that women are finally in our labor force. And as we look to solutions, we want to make sure that there's paid sick leave and that finally women get paid equally to what their white Caucasian counterparts would make. Latinas have the biggest pay gap. We earn 53 cents to what a Caucasian male counterpart would earn doing the same exact job. And so as we look towards the future, it's making sure we're closing that pay equity gap, making sure that there's paid sick leave, making sure that our workforce, who are parents and who are caring for others, are able to have that flexibility. And I will tell you, Randy, I'm fortunate. I am privileged that I can work from home. I am privileged that I'm that, 2/3 of Latinos who has access to technology and broadband. But I know that 1 in 3 Latinos nationally do not have access to technology and broadband. And then you start thinking about how many individuals within our community, Randy, are not computer literate, still have to, figure out how to even access a form online, be able to sign up for the vaccine. And so as I think of the future, I think it's really making sure that we're working with having initiatives, not only within the federal government, but even the private sector, to make sure that these workplaces have pay equity, paid sick leave, and so many other things that are important to working women. I will also tell you, Randy, that in this moment in time, our community, our Spanish dominant community, is being hit with an amount of misinformation on the vaccine that we're not tracking. And we have flagged this for Facebook, we have flagged this for Google, we have flagged this for Twitter, because we want them to begin tracking this analytics. What I can tell you, Randy, is that we think that our Spanish dominant community is getting somewhere between 2 to 3 videos that are anti-vaccine per day. And so forget the hesitancy rate. On top of it, you have fear, and now you have a layer of misinformation. And
Yep.
so there is a lot of work ahead. I'm going to stop there because I know we still have to hear from Dr. Harris and Dr. Rios, but happy to continue diving in. And
Great.
please know that it's an honor to be here with all these wonderful leaders in our country.
And Cindy, thank you, and thank you for raising those videos, because this is what I actually wanted to ask Dr. Harris about. We have, what we've seen is that if we actually do the work of talking to families, I have one of our friends is the leader of the North by Northeast Health Clinic in Portland, Oregon, which is a health clinic that is basically focused on African American males. And what she said to us is we need to actually reduce the age in terms of making sure that there is an availability for the vaccines in our communities of color for people who are much, much younger, bring all families in, and really try to focus in terms of how we really address making sure that there's real vaccine access. But what we've also seen is what Cindy just said, which is there's lots of misinformation going on. in terms of trying to stop people from taking the vaccine. And there's lots of this kind of underground misinformation in some ways that feels like it's really venal and really an attempt to create chaos. And so what are you've been doing so much, but Dr. Harris, what are you doing on the front line to deal with this, to address this, if this is what you've seen as well? And what do you need us, again, as an education and as a healthcare union to do to assist?
Well, Randy, first of all, thank you for this opportunity. And I too feel it is an honor and a privilege to be on this power panel of women, particularly during Women's History Month. And I also want to note a point of personal privilege is that I am a daughter and a niece of teachers. And so I so appreciate all of the hard work and want to thank the teachers, all the school personnel, the nurses for all the hard work. And as a child and adolescent psychiatrist, I've known for a long time how valuable teachers are, how valuable our school system is, and how many roles you fill, many uncompensated. And I want to express a note of appreciation for that as well, particularly around mental health. And I was so glad that you raise issues around mental health and trauma, because we are going to have to prepare right now. We should be preparing right now for the mental health needs related to COVID. Although I think everyone knows, as Dr. Nunes-Smith has discussed, this pandemic has really just exposed a lot of fault lines: public health unpreparedness, the lack of a mental health infrastructure, health inequities, the disproportionate burden on women as well. And one point that we should also raise is the issue around unpaid caregiving, which women disproportionately bear the burden of. So all of those are critical issues, but misinformation and disinformation has really interfered with our ability to make sure that folks have accurate information they need regarding COVID, regarding vaccines. And it's so important. I'm so glad Cindy talked about the need to call on, not just call out, as she also did. And she called on our social media platforms to make sure that they are not disseminating further misinformation, because it is dangerous, right? And Randy, you noted there are some that are intentional regarding the misinformation, and we certainly need to highlight that. We also want to make sure that we separate that from folks having appropriate curiosity, right, and appropriate questions, and are asking about really the science and the data and the evidence around these vaccines. We know issues around trust and mistrust, particularly in Black and Brown communities. So we do need to meet people where they are. We do need to make sure that we are a part of accurate information. That's why the American Medical Association, along with so many others, is proud to be a partner with the Ad Council's new campaign. We need to make sure that we have trusted messengers out there. I've seen a lot of our faith leaders engaged and involved. I have actually been out there on social media with my own experience with getting the vaccine, because I think it's important that we tell people what we know, but also what we don't know, and that we are truthful and candid about the information, particularly around the side effects, because we don't want folks to be surprised if they have side effects, knowing though that for me, and I shared those 12 hours where I had a fever and I didn't feel well, were certainly well worth it in decreasing my risk of serious disease, hospitalization, and death. So we really do need to make sure that we are combating the misinformation. In fact, earlier today, I participated in a town hall with folks in the media, those who buy advertising, those who place advertising. And I really charge them with being a part of the solution. And I will say 3 other concrete items that I shared with them that I think all of us could use as we are looking at what we need to do. The first is, if we are seated around a table, a decision-making table, there should be 2 items written out explicitly on every agenda. The first one, at the very beginning of the meeting, we should look around that decision-making table and we should ask, who is missing, right? And again, that should be written down on the agenda, who is missing, because so often we don't include communities, the very communities that we want to trust us regarding scientific information. They are not included on the front end. So we need to make sure we are asking who is missing, and then we are committed to bringing them to the table the very next time. And at the end of the meeting, there should be an agenda item that says, what have we missed? If we are really committed to equity, and equity around a lot of issues, around women's issues, around vaccine hesitancy, around maternal morbidity and mortality, what did we miss? And what should we add to the next agenda? So those are just a couple of concrete things. And I'll say one more thing. I like the issue and bringing up around access to technology. I've said somewhat tongue-in-cheek that when folks are looking at solutions and thinking about solutions, they should think of what they normally do and then do the opposite. Because in our world today of technology focus, we found that we needed to go door to door. We needed to pick up the phone. We needed to have drop-in vaccination appointments. So those are the things we don't think about. And I'll end with something that I just saw tonight on the news. And I think it's not, it wasn't intentional, but we have to be intentional about addressing these issues. So there was a plea to call. There was a 1-800 number set up for calling for access to vaccines. But then the very next breath was, go to our website for further information. And so again, the very folks that they were trying to reach, they probably miss with that last bit of information. So we need to really be intentional and do things that we don't normally do to make sure that everyone has equitable access, not only to vaccines, but to testing, but going forward to mental health care and really health care in general.
Thank you. Oh my God, that was so much. I'm like writing notes down. Thank you so much. How do you know so much in 5 minutes? Thank you. Thank you, Dr. Harris. And our last Shiro on this panel is Dr. Rios, who is the president, as I said before, the National Hispanic Medical Association, and you represent over 50,000 Latino and Latina physicians throughout the country. And so I just, again, I want you to focus on the NHMA Vaccinate for All campaign, and again, what we can do to help you get the message out about vaccines and what else we can do to help address disparities. And thank you, Dr. Rios. I'm sorry. I think you're on mute.
Okay, I'm unmuted now. Thank you, Randy, for inviting. And I do want to say it is important to have the teachers involved, and especially I think the vaccination sites should be at the schools. There may be some chaos with having a bunch of old people come into, the student bodies, but I do think that, there are auditoriums, there are outside, yards, football fields, what have you, where vaccinations could be, and I think that would be role modeling for the students as the vaccinations become available to the younger generation. And I do think also that teachers need to be able to have teaching moments, and the teaching moment of seeing vaccinations and what is that and what are they doing. And I remember getting the polio vaccine in the 50s at a church. I also think the church.
We are losing Dr. Rios. I think you're back.
Okay. I also think that we should use the churches more. In the 50s, in our communities in Pico Rivera, California, Mexican American and Anglo middle class, communities, we went to the churches to get the sugar cubes. The other thing I'll say, the NHMA Vaccinate for All was named because we saw a lot of, the Ad Council, we're very proud to be a partner also, is calling their campaign, It's Up to You. The other groups are using Take Your Shot. And it seems to be more individualistic. And maybe it's proactive. But we thought in the Latino community, it's important to talk about all, meaning all the family. That all the family needs to be vaccinated. And that we're all protecting each other. And so often, women, especially in our families, don't take care of themselves, they take care of everybody else. And we have to remind women that they have to be part of the solution too. And getting vaccinated is the first part of protecting from the COVID disease. And I think all the vaccines, no matter which one you get, have been shown to be very safe and very effective in decreasing the COVID disease. The other thing we're doing, and let me just say, we're supported by the CDC, Johnson & Johnson, and Bio, to be able to develop messaging, but more importantly, messengers. We're looking for individuals in our communities who are leaders, and not only doctors and nurses and dentists, but community leaders and teachers. We'd be happy to work with you on that. We're developing social media and also working with a PR company called Culture One World, who worked on the census, developing messages that resonate with the local communities especially the underserved and especially Latino. English and Spanish information will be available, and we have a hub to sign up. We're asking people to, the call to action is to pledge to help us deliver the message to all of our communities. And it's at our website at nhmamd.org, the Vaccinate for All campaign. The other thing I'll say is that we are developing a concept of leadership development, because we think it's important to find more doctors, especially the Latino doctors that are very few in our communities, but are very, trusted as our nurses. My mother was a nurse. But I think that the doctors in our communities need to be trained on public health. They so often in academics are focused on research or focused on promotions, and in private practice they're focused on business, and nobody is thinking about the population, and more people in our communities do not get into the healthcare system or the healthcare enterprise because they don't have insurance, or they don't talk the language. They have health literacy issues. They have financial issues, and so we need to be able to connect doctors who are in private practice in the community with the public health departments. So we're part of our Vaccinate for All campaign is actually we will be training through our NHMA Leadership Fellowship public health leaders for the next generation. And actually we're taking recruitment now of mid-career doctors, Latino doctors who are interested and who already have shown leadership by their experiences and have a commitment to public health in their careers and have a commitment to Latino healthcare. So in a nutshell, that's what we're doing, and we're looking forward very much to making changes. And I think one of the other disruptive types of changes I just wrote out is we really need the FQ, the frequently asked questions that we see to be reflective of, put yourself in the shoes of the Latino kids and how they would explain information to their parents. And I do think it's the schools that have the way to change things in our communities, because they so often give information that kids really enjoy learning about, and then go back to their families and talk to them about what they learned. And so we need the vaccine information to get to that level and to be relevant to the different communities, whether it's a Latino family, children talking to their grandparents, talking to each other, their cousins. And I think that's going to be the way to disrupt the information flow.
So one of the things, I'm going to put Dr. Nunez-Smith on the spot, particularly since she's already given us more time than she had, just to kind of reflect on some of the things that she heard. We did hear, by the way, Dr. Nunez-Smith, that after the labor leaders were with Vice President Harris, she went right to the West Wing to a meeting with the president, and she like downloaded all the things that we had just said. So, I think, are there things here that you think we could systematize to make into policy? So, for example, in LA, we're thinking about how to actually have families vaccinated with in the schools, and how, as shots become more and more available, we can use schools as vaccination hubs for families. And that's one of the things that in LA, in New York, and other places we're trying to think about. We already know that the administration has done this in terms of churches. And my wife, who's a congregational rabbi, is trying to figure out how to make, our synagogue one of those vaccination hubs as well.
Yeah, great. So I knew I would not be disappointed, right, to be on this panel and to listen and learn just really so much here in terms of best and promising practice. I would say absolutely the answer is yes. I think there are just a lot for us to explore in this realm of innovation. And when we have these conversations around access and acceptance, I always say our first job is to show up. I mean, exactly right. People, we have to meet them where they are, but we can't have meaningful conversations about providing people information or vaccine confidence unless we have ensured vaccine access. And so certainly in the federal vaccination channels, we're trying to model a lot of this best and promising practice. Partnerships are just key. We've heard this tonight. And it's about, yes, trusted messengers, but also about creating vaccination venues that are easy and convenient and that are also trusted. And so, as we talk about things like schools and churches, it is really key that we make sure that we are doing that work so that people can get vaccinated in those different venues. From the federal administration, we have already at the mass vaccination sites thought through a lot of the structural barriers that are here. And I think that's important for states and locals to also do. How are we overcoming those registration barriers, thinking about transportation, holding registration spots for churches and others to register their clients, their members, their congregants? How do we target geographic eligibility? All of those questions. How do we use mobile units, right? Importantly, to take vaccine to people when we need to. So all of these access questions. In the pharmacy program, thinking the same about where we locate those pharmacies, where we locate those mass vaccination sites, and of course the community health centers and how we partner with those assets. I mean, really just tremendous assets in our communities to increase access. So lots. I too was taking notes if you saw. I think there's just so much, not a surprise here, but we cannot underestimate the power and necessity of partnership, because we know that kind of getting the vaccination venue right is step one. And everything else we've been talking about tonight is really the next piece. How do you actually connect people with vaccine and vaccination?
Fantastic. And I know you have to go. So, when your picture goes, don't worry about it. We know you have to go. And you've given us more time.
This is like the best slumber party that I don't want to leave. I just say thank you to everybody. Deep gratitude for everything. And again, to AFT for the partnership.
Thank you. So let me ask, because we have tons of questions, but let me just ask everyone, because we promise everybody when we do one of these that we're not going to do more than, an hour. But if there was one takeaway that you want to leave our educators, our healthcare practitioners, our faculty members, our and their families, our state and local employees that we represent, and the many, many, many retirees that we have. If there was one thing you wanted to leave us with, I'm going to actually go in reverse order this time and start with Dr. Rios, and then go to Dr. Harris, and then go to Cindy, and then go to Julia. And so what would it be, Dr. Rios?
Yeah, I saw the Kaiser Family Foundation did a survey in December about the vaccines. And I think it was 7 out of 10 Hispanics that were interviewed said they would take it. And many people think that Latinos aren't interested or aren't fearful, or there's a lot of other reasons. But I think that there is enough information out there to understand that a vaccine helps with being healthy. And I think more people in our communities need to share that feeling that getting the vaccine is better than being in the hospital on a ventilator or dying. And that's something that the mainstream just I don't think understands, that the Latino people are very interested in getting that vaccine.
Fabulous. Thank you. Dr. Harris.
Randy, I'm going to go broad here, and I'm going to tell everyone to remember self-care. This has been a very difficult time, and particularly as women, we tend to care for others and put ourselves last. And so I have been telling everyone to remember self-care. Each of us should give ourselves the grace and the space to feel how we are feeling. And there is no shame in seeking help. Often women feel like and I know there's the stereotype of the strong Black woman. There's the reputation of the strong Black women, and, all of us women, and we were the backbone of the family, and all of those things are true. But sometimes those, I wouldn't call them stereotypes, but those myths, if you will, make it difficult for folks to seek out help when they really need it. So my take-home message is to remember self-care, give yourself the grace and the space to feel how you are feeling. And when you need help, ask for it. There is no shame, and there should be no stigma. We will have to continue to work on the stigma piece in seeking out help.
So great, Doctor, for saying that. And as you said that, I thought about my first Zoom today, where we were talking to a whole lot of our members, and I raised the issue about we have a trauma benefit. We because of so much stress that educators and healthcare workers feel and navigate through all the time, we decided to pay for a trauma benefit for all of our members. And the stigma actually does stop people from utilizing it. The best thing, and I said to people this morning, is the best thing that I could find out from the trauma benefit carrier is that there's been so much use of it that they're going to charge us more for it. That would be the best money that the union could spend. And so it is, there's no shame in this. We have all been through so much. And so self-care, thank you for saying that. So important. And if you're a member of the AFD, we have a trauma benefit. We have it on our website. We have, and you're entitled to use it. Sydney.
Thank you. And just a shout out to all of our teachers, our educators, our nurses who are on the front lines, Randy. And what I would say is that we need to invest more in mental health resources for our communities. And why I bring that up is because we have to understand the realities that so many in our community are facing. And it literally almost brings tears to my eyes, because just the other day, a mother was forced to make the decision if she was going to buy flour, beans, and cooking oil versus laundry detergent. So many families are self-evicting because they don't want to end up in court. So many older siblings are taking care of their younger siblings so that that single parent, that single mother is able to go to work and provide for them. And so as I think of, where our communities are, we absolutely have to meet them where they are. And if that means door knocking, if that means at the church, if that means at the grocery store, if that means walking into that rural community that never gets touched, then that's what it's going to take to make sure that we remember that here in America, all of us have to be a part of the process, irregardless of our backgrounds, irregardless of our geographic location, irregardless of our immigration status. And so, Randy, acknowledging one, the work of our teachers, our nurses, our doctors, thank you. And to just be mindful that so many of our communities, so many of our parents, so many of our children are suffering in this moment, experiencing food insecurity, experiencing financial insecurity, and also dealing with that layers of stress that's being compounded on top of everything that is happening. I think it's something for us to be mindful of as we move forward.
Thank you, Cindy. Thank you so much. And Julia,
Yes.
the last of our sheroes for tonight. Your last word to us.
Yes. I agree with everything anyone has said. And I too, Randy, want to say thank you to AFT and thank you to the Washington State nurses that I'm part of too, because the next thing I'm going to say is something that both of you have helped with a lot. And I think it is that you need to ask the helpers how to solve things. And with nurses and healthcare people, we solve things. We've been solving things for patients for a long time. We've been advocating, and we're here. We don't want new solutions and systems made that aren't going to work. We want to be asked, and we want to be in the forefront of helping and coming together with other organizations and women like we have today on the panel, because we know what has been broken even before this pandemic, and we know how to fix it if someone would listen. And so that's my takeaway for today is ask us to help, give us opportunities, and we'll in turn ask other people to help. And together, we're going to be able to solve this and actually make it work instead of trying to reinvent the wheel and it doesn't work and we go back and do it again. So that's my final word.
Thank you, Julia. And next week, I'm so happy that I am, because I am double vaxxed and I'm going to be able to be on the West Coast with our nurses who I have not seen since the pandemic started and healthcare professionals in Oregon, in Washington State, and hopefully in Alaska, just to actually really say thank you and actually be able to still do kind of a virtual hug, 6 feet away. But I really want to say to all the healthcare providers and the activists that have been on this call, look, this has been a really tough time. And I think that Dr. Harris and Dr. Rios, Julia, Cindy, Dr. Nunez-Smith, Dr. Redliner, who we had a couple of weeks ago, you see the hope. You see 100 million vaccines into arms, 6 million vaccines this weekend. You see the hope. You see the kind of race we are in right now between variants and vaccines. You see every time where, Moderna is now doing its clinical trials for vaccines for kids. And we're hopeful in terms of that those clinical trials will turn out fine. You see hope. You see an end to this pandemic. But it's been because of all of you. The kind of solace, the kind of grace, the kind of gratefulness that we all have when someone in healthcare comes and holds our hand and looks us in the eye and with that kind of knowledge and expertise, whether it's a nurse, whether it's a doctor, whether it's an activist in teaching and learning, whether it's a teacher, a paraprofessional, an educational support professional, a bus driver, that look that says, we got this. And that's what you've all done. And I can't thank you enough. This Women's Recognition Month, I can't thank you enough for the work you've done to help a nation that needed that help, scared to death about respiratory disease, that you have helped us get through. Thank you, everybody. And thank you to the people who've been watching. But I want to say thank you to Sydney Benavides. Thank you, Julia Barcott. Thank you, Patrice Harris, Dr. Patrice Harris. Thank you, Dr. Ilana Rios. And thank you, Dr. Marcela Nunez-Smith, for joining us today for this very, very, very special town hall.